Stop. Smart. Head down.
All human beings are born equal and free in dignity and rights.
Le droit à la santé, le droit à la santé. Ah, ça y est. Hey, listen to this. I found the Constitution of the World Health Organization, and it says that, quote, "The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being."
So health is not only for people with power and money.
And without health, how can you enjoy all of your other human rights, like the right to work or the right to education?
But what does it mean in practice? Health as a human right?
Well, it says here that governments have committed themselves, and I quote, to take steps necessary to achieve the full realization of this right. Such steps include the prevention of diseases, so things like immunization, clean air and safe water, nutritious food.
Alors qui me dit à quoi vont servir tous ces aliments si nous les mangeons, Clément?
À construire des muscles, des organes.
And also making sure that everyone who needs it can get treatment and care.
It's especially important to pay attention to the rights of people who are vulnerable or marginalized. For example, people living in rural areas.
So the right to health is about creating an environment in which people can fulfill their potential to be healthy.
I'm sorry I had to leave. I'm back now. I just heard what you said. It's true. The right to health is an inclusive right. It includes access to health care, as well as what we call the underlying determinants of health. Things like, adequate housing, safe and healthy working conditions. This is really important to your studies. And remember, the right to health is an obligation of the whole government, not just the ministries of health, but other sectors like finance, planning, trade,
Yeah,
and
but
so
it
on.
must take real leadership and political strength to make all parts of a government move forward and do it together.
And surely we cannot expect governments to make the right to health happen just like that.
No, but they are committed to taking targeted and concrete steps towards it. Of course, the right to health cannot be realized overnight. It takes time and it takes lots of effort.
International cooperation is very important in human rights law.
That's true. And don't forget that governments undertake to guarantee the right to health without discrimination of any kind whatsoever.
So that means that whether you're man or woman, rich or poor, whatever your skin color, your language, your religion, your political opinion, you have the right to...
But it's not enough just to pass laws against discrimination. Take HIV, for example. Simply banning discrimination because of someone's HIV status will not change people's behavior. Just look at how this woman was treated by her own neighbors.
Those who come to me, they are those who are interested in me. But those who are not interested, they're fearing me. She's sick. Maybe she's suffering from AIDS. Maybe she's suffering from what? You know how people we are. Is what they think. They fear me. Even this cup of mine, they cannot even drink it with the water. They fear.
That's exactly why the right to information and education are essential to the right to health. If Elizabeth's neighbors knew more about HIV/AIDS, their fear and discrimination could be replaced by care and support.
Can you please come on?
If they knew how HIV is transmitted and how they can protect themselves...
Promoting safe sexual behavior is still the best way to limit the spread of HIV. Education and awareness are essential to prevention and can take place anytime, anywhere, in an office or on the street, through posters and documents, or through street plays like this one. Knowledge on its own is not enough, and to be effective, AIDS programs must also provide useful life skills. Condoms are an indispensable part of HIV prevention, whether used by men or by women.
Did you know that individuals in groups have the right to take part in decisions that affect their development?
Yes, it says that this is an integral component of any policy, program, or strategy developed to discharge governmental obligations.
There are international, regional, and national systems to make sure that governments are accountable. And accountability is a key principle of all human rights.
So governments all over the world have committed themselves to respect, protect, and fulfill the right to health.
Health, it's my right.